Good morning. Welcome back. Hope you had a more leisurely coffee break and networking session. There's a slight new, very welcome addition to the agenda. It's my pleasure to recognize U.S. Ambassador Eric Needler, who took time from his busy schedule to come be here for this event. Along with him are Senior Advisor John Carroll of the Office of the Foreign Assistance Oversight, as well as Senior Business Officer Jeff Graham here, Senior Bureau Official, sorry. And he's also the Acting Global AIDS Coordinator. Jeff Graham has agreed to say a few words to the audience here, but let me introduce Jeff to you. As I said, he's a Senior Bureau Official and Acting Global AIDS Coordinator with the Bureau of the Global Health Security and Diplomacy. A career member of the Senior Foreign Service, Jeff Graham is a Senior Bureau Officer, so I mentioned that already. He was inaugural Principal Deputy Coordinator for the Global Health Security and Diplomacy for the Bureau. He leads a team of health diplomats and global health experts to elevate and integrate global health security as a core component of US national security and foreign policy. So without further ado, I would like to welcome Jeff Graham to the podium. Please.
Good morning, everyone. Thank you very much for letting me come and join you briefly. My team in Washington normally attends this conference and couldn't make it this year due to some unique American political circumstances, but I'm in town for another meeting and was happy to come over and talk to you. Before I start, let me just thank Professor Ravi for the introduction and recognize Dr. Darko from the African Medicine Agency and Dr. Loco from the Rwanda Medical Supply, and of course, my colleague, Ambassador Needler. So it's a pleasure for me to come and talk to an event that examines the critical link of supply chains in delivering quality and timely healthcare services. This has been and continues to be a priority for the United States. You know that we're in a time of great change in the way we're approaching this issue, approaching health overall and assistance. So supply chains are a key part of that transformation. U.S. investment in African health, we all know, has saved countless lives, transformed economies, and bolstered local health systems. But ultimately, our investments have created dependency, not capacity. That was not by design, but it was the result of the way we did some of our work over the past 20 years. The new America First Global Health Strategy, which we released in September, seeks to transform our relationship into a market-driven partnership that strengthens African health systems while creating sustainable opportunities for American companies, and of course for African companies. The strategy isn't about withdrawal. It's about smarter partnerships that leverage American technological leadership to create sustainable health systems while opening markets for innovation. Our new $150 million investment in Zipline and the delivery of the first doses of lenacapavir, which you may know, an innovative drug produced by the American company Gilead Sciences to help prevent the spread of HIV, demonstrate this new approach in action. Looking at the current state of health supply chains, Africa represents 17% of the global population, but less than 3% of the global pharmaceutical market. Current supply chains are built for emergency response rather than long-term sustainability. We've seen that fragmentation across the countries we serve through PEPFAR, the President's Malaria Initiative, and other programs prevent economies of scale because we approach them through different programs looking at different diseases, and that American companies are largely absent from the world's fastest-growing consumer market. In our current state, we're dealing with multiple parallel supply chains, PEPFAR, the Global Fund, Gavi, multiple bilateral programs. In fact, I'm down the street talking to the Pandemic Fund later today. Over 80% of essential medicines are secured through international mechanisms with little African private sector participation in health commodity procurement. Despite billions in donor funding, we're still seeing chronic stockouts. So what's the vision? The vision is integrated regional markets. We see a world where an ever-increasing number of pharmaceuticals are manufactured locally in Africa, where private sector companies are responsible for most of the distribution, rather than governments, and where continent-wide supply chains are facilitated by cross-border regulatory harmonization. In this world, the role of donors could become focused on supporting innovation not just responding to emergencies. The path forward looks like this. As I said, we're not abandoning global health leadership, we're transforming it. For over 20 years, we've subsidized emergency response. Now we're building sustainable markets that serve African health needs while creating opportunities for American innovation and for commerce. I will tell you this is a significant mindset shift for many of our public health experts on our teams, but one that they're quite excited about. We want to leverage America's unmatched technological advantages in robotics, artificial intelligence, manufacturing, and innovation. We want to create commercial partnerships that survive changes in political leadership on both sides, whether that's both sides of the aisle in Washington or both sides of the Atlantic with our friends here in Africa. We'll position American companies to lead in the world's fastest growing market. So back to the $150 million Zipline Award. That's a down payment on this vision. Over the next 36 months, you'll watch American technology deliver life-saving medicines to 130 million people on the continent. You'll see African governments paying for that service. So we're doing a seed investment, but the actual payment will come from the governments. Those governments won't be aid recipients, but customers who recognize value. You'll see African jobs created, and you'll see a framework that works. So we call on your support as supply chain leaders to design the infrastructure that this transformation is going to require. We're going to need your help to scale this beyond one company and to integrate private sector delivery into broader logistics networks, to set standards that enable American innovations to thrive, to design procurement mechanisms that reward performance, and to build the sustainable supply chain infrastructure that makes Africa a genuine trading partner, not a permanent aid recipient. I know the trade not aid terminology has been around for a long time, but we're pretty serious in the current administration in making this a reality. So that's the opportunity. Your expertise bridges public health goals and commercial viability. You ensure continuity during transition, meaning no patient left without medicines, despite what's happening politically. You're building the African health market of the 21st century, and that's why this meeting matters. That's why I'm here. And that's why the next several years of US-Africa health partnerships will look fundamentally different from the last 2 decades. That part I can promise you. I will tell you I'm here on country 3 of a 5-country tour, negotiating MOUs across the continent. I have 2 other teams simultaneously. We're going across, I think, 16 countries. And in this process, implementing the new strategy, we're transforming the way the United States does business with Africa in the health sphere. And we feel very confident it's going to work, and we think you're going to see dramatic change. And supply chains, commodity procurement are a huge part of this transformation. So I thank you for what you're doing. I thank you for having this conversation. I look forward to getting a detailed readout of your conversations when I get back to Washington. I'm afraid I can't spend all of my time here with you, but I'm glad at least I got a chance to come over and say a few words and encourage you. Think outside the box. Think about the transition from public health to commercial opportunity. These are not things that have to be, I mean, you all know as supply chain people, these are not things that have to be separate. They can come together and one can lead to the other. So thank you very much, and enjoy the rest of your meeting.
Thank you, Jeff, for those comments and laying out what the new US strategy looks like for engagement in Africa, and thinking about delivery of health also as an economic opportunity in some ways, and building that infrastructure here that would have repercussions for the rest of the economy as well. So thank you so much for being here and sharing some of those thoughts. And thank you, Ambassador Keeler, for taking time off and being here. At this time, I would like to invite Prashant. To our US colleagues, the heads of central medical agencies met here yesterday, and I want Prashant to come and recognize some of them here. Thank you.
Thank you, Ravi. Thank you, Jeff, Ambassador Keeley. I want to just say 2 things. One is, similar to what you heard Dr. Loko Ibrahim describe what they're doing at Rwanda Medical Supply, his peers and counterparts in many countries who run the public agencies for medicine supply are the ones where all of the work that we talk about, all of the opportunities, or whether it is bringing commercial new technology or using our mainstream ways of doing delivery, that's what it essentially comes down to. So there were quite a few of them who had come here yesterday to discuss amongst themselves how they can advance in running the procurement function, the supply chain function, but some of them are still with us, others had to leave to actually go back to their day jobs and run the agencies. So I just want to recognize them who are with us here in the audience. So Jane Banda, the head of the Zambian Central Supply Agency, Dr. Jatu, the head of the National Medical Supply Agency of Sierra Leone, Luisa Abeye, supply chain lead for the Central African Republic, Dr. Peters, the head of the supply agency from Liberia, and our colleagues from Guinea-Bissau who were here. I can't, so the supply agency of Guinea-Bissau, and also members of this new cabinet committee that is trying to reform the supply chain in Guinea-Bissau are here as well. So the reason I'm going to recognize them is they are the ones who every day deal with operational problems. They are the ones who have to manage procurement lines. They are the ones who have to do partnership agreements and MOUs. They are the ones who have to deal and negotiate with suppliers. And they are the ones who've got to manage supplies and multiple calls from the ministers saying, why is this not working? And I just want to congratulate them for the work they do, honor them, and recognize them. Thank you.